Good morning, good afternoon, and good evening to our audience joining from the United States, Bangladesh, and around the world. My name is Haris Samad, and I'm the Assistant Director of the Atlantic Council South Asia Center. It's a true pleasure to welcome you to today's webinar about Bangladesh's post-pandemic political, economic, and healthcare landscape. This program comes at a critical time for Bangladesh as it battles intersectional challenges of COVID-19, an economic slowdown, and the ongoing humanitarian crisis of Rohingya refugees residing in the country, among others. Today's conversation is also the second in a series on post-pandemic South Asia, with the first session taking place in February and focusing on Pakistan. And I've just dropped the link in the chat for your convenience. Joining us today is an esteemed panel. Dr. Rudabeh Shahid, who is a non-resident senior fellow with the Atlantic Council South Asia Center, as well as a postdoctoral research fellow at the University of York. Dr. Ali Riaz, who is also a non-resident senior fellow here at the Atlantic Council South Asia Center, as well as a distinguished professor at Illinois State University. Dr. Fahmida Khatun, who is the executive director of the Center for Policy Dialogue, and Dr. Mofijul Islam Bulbul, who is the deputy program manager of the Bangladesh Ministry of Health and Family Welfare. Moderating this panel will be Dr. Irfan Nuruddin, director of the Atlantic Council South Asia Center and a professor at Georgetown University's School of Foreign Service. A reminder to our audience that there will be a Q&A session later on, so please submit your questions via the Q&A function at the bottom of your screen, and we will try to get to as many as we can. And finally, a note that this program is of course live and thus on the record. With that, thank you again to our esteemed panelists for joining us today and for providing your insights on the situation in Bangladesh. Irfan, over to you.
Greetings. At the start of 2019, Bangladesh was riding an incredible amount of momentum. A recent election had handed the Bangladesh Awami League a resounding mandate for a fourth term in office. The Bangladesh economy appeared to be flourishing, eclipsing even India as the fastest growing economy in South Asia, and one hope for an even brighter future for the nation of Bangladesh. 2 years later, of course, the world has been buffeted by a pandemic that none of us saw coming, that has caused untold misery and suffering around the world. The implications of that pandemic extend not just to the health sphere, though that is obviously the primary concern, but have knock-on effects for the economy, for livelihoods of the underprivileged and marginalized, for political success and political survivability of the governments charged with fighting the pandemic, and with broader geopolitical implications as the United States first struggled to mount a successful pandemic response domestically, flailed at exercising international leadership internationally, providing possibly a role for China to exert a whole new version of vaccine diplomacy, for India possibly to have done the same. As the pandemic enters this new phase in which the United States appears to be ready to emerge from the worst part of its pandemic experience, thanks to an increasingly successful vaccination effort, as Europe remains mostly locked down, but with hopes of vaccination, the gaze needs to shift to the developing world and to South Asia, where challenges of vaccine equity and of the large, poor population that does not enjoy first world access to healthcare infrastructure has to be the new focus. And so the South Asia Center is very proud to have convened a series of conversations about what post-pandemic South Asia might look like, fully recognizing, of course, that we are a long way from the post-pandemic. I am joined by the esteemed panelists that my colleague Haris Samad just introduced. I will not give you further introductions of them, but we will jump right into the conversation. I've asked the panelists first to use their relative expertise, though they're all experts on all of the topics we will cover today, to paint for you a broad overview of the key facets of the situation in Bangladesh that we might keep in mind as we then begin to delve into their analysis of what comes next. So with that, Dr. Bulbul, given your position at the Ministry of Health, let me start with you. At the end of the day, this is, of course, a healthcare crisis. What should we know at this point in time of where Bangladesh's COVID situation stands and what the immediate tasks for you and your colleagues are as you fight it. Over to you.
Thank you, Irfan Nuruddin. Thank you very much. First of all, I would like to thank the Atlantic Council South Asia Center for arranging such wonderful events. Though this is very much important issues to talk about the COVID-19 pandemic, how it will actually affect the country's politics, economy, and healthcare. First of all, I express condolence and sympathy to the families of the victims suffered by COVID-19. We all know that every country globally actually facing challenges of this COVID-19, especially as you told that it actually disrupt our life and livelihood. So Bangladesh has seen its first case in 8 March 2020, and first date was 18 March 2020. Until today, we have total number of positive cases, 7,76,257, and total death is 12,005. And we can say that if you consider regarding the Asian countries, it's not so much, but till the death rate is 1.55 and case detection rate is 13.71. However, after inception the outbreak, the government was quick to respond under the able leadership of our Honorable Prime Minister Sheikh Hasina. And through this spirit, we actually adopted whole of a government approach, giving emphasis on surveillance and laboratory support, tracing, screening, infection prevention control, and community engagement. We adopted National Preparedness Response Plan for COVID-19 in line with WHO Global Strategic Preparedness and Response Plan. We have till now almost developed more than 40 guidelines as well as SOPs to prevent and manage COVID-19. We almost ensured, nationwide lockdown from March 2020, and now recently we are experiencing the second wave of this COVID-19. So death number was increasing. Last 1st May of 2021. Fortunately, it's becoming lowering since today. Till today, it's becoming lower. So hopefully, because of our government has already given all the activities very much in align with the guidelines. We do not call it lockdown, but in a sense of lockdown, or a very precise working environment, maintaining all the hygienic issues. We have set up, yes.
If I could have you hold off a little bit on what has been done right now, but thank you so much for that comprehensive overview. 707,000 cases, over 12,000 fatalities. And to the extent that we can extrapolate from other parts of the world, with all due respect to the data collection that your government and your ministry is doing, one that is almost certainly an undercount relative to the actual prevalence of cases around. So the challenge that you and your colleagues have had to deal with is quite unprecedented. Dr. Khatun, the implications for the Bangladesh economy, which as I mentioned was really seemed to have picked up incredible momentum entering 2019. Could you tell us what your analysis right now of the current state of the economy is? Which sectors seem to have survived intact, if you would? Which ones have taken the greatest hit right now?
Thank you very much, Dr. Nuruddin, and I would like to thank Atlantic Council also to invite me to speak on this very important topic. So, yes, you are right that Bangladesh economy was on a really, momentum with high growth and high performance in a number of indicators, particularly macroeconomic indicators. And in fact, Bangladesh has been one of the fast-paced economy among its peers before, till, in fact, till the COVID-19 had hit us. So after the COVID-19 hit us around in March 2020, if you look at that the 3 quarters of that fiscal year 2020 was already gone. So we were left with 3 months of the ongoing fiscal year. So as a result, the from the government it was said that the economy had already past majority of a main some of the most important period of it, so the impact wasn't too bad. But however, if we just, I'm just going taking you back a little bit backward, then I'll come to the present issue, that even before the COVID-19 had hit us, the economic some of the economic indicators were under pressure, particularly the export, import, investment, and of course private investment particularly, and employment. So those were taking a hit for for a number of months of that particular year. So when the COVID-19 had outbroken in the country, the situation had further deteriorated. As you know, that this is a crisis which had disrupted the production and the supply chain within the country and also outside the country. And so this has created a supply constraint, and at the same time, it had also created a demand crisis because, as production had been interrupted, businesses had to shrink their, operation, and there had been unemployment, and also because the country had to undergo a lockdown to contain the spread of the COVID-19. So many people, particularly those who are in the informal sector, they had lost their jobs. So this had created a demand crisis also. So this is a crisis, as you know, like no other. It had created both supply and demand pressure. At the end of the fiscal year of 2020, that is last June, Bangladesh economy was projected to grow at a rate of 8.2%. That's what the government had projected. But finally, the government had estimated that the growth was 5.2%. But however, the 5.2% is also very high, given that many countries had negative growth or even just mere 1% or so. So Bangladesh, from that point of view, was an outlier, I would say. But there are, of course, there are debates on the numbers. I'm not going into that number, but having said that, that this growth was very high, but to some extent, I would say that there are a number of factors which had contributed to that growth also, because towards the last quarter of 2020, that around September, August, September, the export, particularly the ready-made garments export, had started to pick up, because in April 2020, March, April 2020, many buyers had cancelled their orders or suspended their orders, and so it had really dipped. But however, it started to regain. This was one factor. And also the remittances had been really robust. It had experienced record growth. So those are some of the indicators which had helped Bangladesh economy to to stay afloat at a better footing compared to others. Now, and then as a result of that, towards the third quarter of the current fiscal year, that is 2021, and that is around February this year, we started to think about the recovery, that probably the impact of COVID-19 is receding, and probably it is fading away. And we are now going to concentrate on recovery of the economy. And we are discussing that what kind of recovery would be. Will it be V-shaped? Will it be W-shaped, L-shaped, K-shaped, as suggested by the International Monetary Fund? And we are also analyzing that, probably we will be having a K-shaped recovery, meaning that some of the sectors of the economy will recover faster and better compared to the other sectors. However, as you know now, in March, so we are observing a second wave, and this second wave is even stronger, and the impact is going to be more dire probably. We don't know the numbers, but however, the information or the data what we have on the overall macroeconomic scenario now, we don't have real time data, but some of the data till March of this year. So we see that there are a number of depressing indicators, in the sense that if we look at the public investment or private investment or revenue mobilization, so this we don't see much of much momentum in that. Because if you know that during a crisis of this scale, one of the important impetus is that increase in public expenditure investment, because that is where as you know, that the role of the state becomes so important, and the state has to come forward. So the government has to invest, made higher expenditure, so that the economy has more money, employment is created, people have more money in their hand, and they can spend, and the economy goes into a
Right.
vibration.
So if I may
However, we
ask,
have seen that though the government had planned for a higher budget deficit, that is usually in Bangladesh the budget deficit is about 5% of GDP. This year it has been increased to 6%. But the data so far, we are seeing that we haven't done very well. The public expenditure has been rather conservative. So, and also we see the private investment has been always, for the last couple of years, it has been stagnant at around 23% of GDP. Now, during the COVID period, there is no reason to have a more faster or more, higher investment by the private sector. So there is this crisis that when we are trying to create more employment and more income, we are seeing a lower investment, which means that if this is the trend, it's going to take us longer to recover from that. I think your time is up for this segment. I would stop
yes,
here. We can
ma'am.
explain it.
Thank you.
Thank
I
you.
realize to ask an economist about the economy so much complexity, and you've done such a wonderful job of painting that picture. But thank you for allowing me to move the conversation forward. We'll come back to you in a couple of minutes to really delve into what the government should be doing from your perspective. Dr. Riaz, the focus on the government provides a segue to me to ask you. As I said at the outset, the Honorable PM Sheikh Hasina entered 2019 with a pretty significant mandate. Our government has had to deal with the crisis unlike any other, just as every government around the world has. From your perspective, not so much your assessment of the performance, but what do you think the mood in Bangladesh is in terms of how they assess the government's performance? Is this a political crisis in addition to an economic and health crisis? Or do you think the government comes out of this looking like they've done the best job that they could have done under very, very difficult circumstances?
Thank you, Irfan. 2 points here. You have mentioned about the mandate. As a matter of fact, you need to locate the political developments and what is happening right now within that context. The 2018 election that you have mentioned has been described by international press as transparently fraudulent. So the mandate that we are talking about is actually hollow in the sense of the moral authority and moral legitimacy. Constitution, it is correct that the Sheikh Hasina government has won the election. But with this moral legitimacy crisis and increasing authoritarian tendencies that we have seen practically since 2014-15, it has accentuated, accelerated post 2018, and COVID-19 has provided that opportunity for the government to clamp down more on the freedom of expression Dissent has been criminalized, persecution has become normal, the decimation of the civil society we have seen, and it is taking place within the context that there's a lack of transparency and accountability. Hence, what we have seen, you have mentioned about the undercount of the numbers, like any other places, but more so because of the lack of transparency that we have seen. The government's failure in that respect, the number might have been very small in terms of death or the infection, but it is not only the number that we need to look into. What we need to look into is to how it has been handled. Look at how it has been handled with respect to the vaccine question uh, or for that matter, the enormous corruption that we have seen in health sector and beyond because of this lack of transparency. And that is why, despite the fact that, yes, the persecution, so to speak, even in social media, I mean, I can give you numbers. One single law called Digital Security Act has been used as draconian as possible. And we have seen, at least to my count, at least 56 individuals have been charged by the government and the pro-government loyalists against individuals for just expressing their opinion. We have seen over since 2020, the doctors have been, told to go to other places, made official officers on special duty. Journalists have been arrested, and so the entire criminalization of dissent that we have seen has created a fear culture. So the politics that you see, whether the government has succeeded, what is the challenge? The challenge that they are witnessing is there might not be on the street agitation that we have seen previously in case of Bangladesh. Instability that we have experienced in Bangladesh might be absent from the outside if you're looking at it. But the growing discontent has been expressed on various occasions on social issues. And in similar fashion, if you look at the complete disregard of the so-called, uh, uh, what has been described as non-lockdown lockdown, so to speak, the public healthcare system has not worked. However, it has not worked. That is the point that we have seen. But in terms of economy, what we have seen is all these 23 or so stimulus packages have not reached who it should have been reached, the most marginalized and poor people. These are the political challenges. Whether the government might not see that one on the street because it is not on the street, but it is in the mind. And more importantly, by clamping down on the civil society, by clamping down on media, creating a fear culture. What the challenges are? The challenges are whether this pent-up thing would actually at one point become a major problem for the country. And particularly on the vaccine question, the lack of um, how does she say, I mean, actions when it was necessary. And it is a classic thing because what we've seen, even by admission of the foreign minister, that the entire agreement with India was done for the, under the pressure of one private company. And this is astounding in any respect. So what is the political situation? In brief, the political situation is that, yes, the government has complete control, but it is the coercive control that we have. Yes, government is saying whatever they can do. Yes, because there's a lack of accountability. There's a lack of transparency. And this entire thing of this small rent-seeking class having the benefit of this COVID crisis. On the one hand, politically, they're benefiting out of it. We've seen it elsewhere, the authoritarian tendencies elsewhere. Same thing is happening in Bangladesh. So that is what the political situation seems to me.
That's remarkably succinct and, if I may say, provocative, even depressing summary. Can I just come back to you maybe in a couple of sentences? What is the state of the opposition at this point? Is the opposition able to gain any traction with the critique of the government, or is
no?
Unfortunately
not. Unfortunately not, because of the two, or you may say three reasons. And I will be very brief. First thing is the state of the COVID itself is preventing, not only in the Bangladesh, elsewhere too, we have seen. That is number one. The second thing is the absence of leadership and direction from the opposition, particularly the major opposition political party, Bangladesh Nationalist Party. However, we need to footnote here that the opposition does not necessarily have to be a political party like BNP. There are growing sentiment on this. And the third point is that, again, going back to this, the we need to look at how this system has evolved into what I described as a hybrid regime, meaning that there's a facade of the democracy, but essentially the system itself is crumbling. So to respond to your question, there is the opposition is rudderless. Let me put it very bluntly. But that does not mean that the government has morally gained authority that of their governance.
Right. Thank you. No, I appreciate that clarification. And obviously, one doesn't have to look very far to New Delhi to see a very similar sort of situation.
Absolutely.
Opposition and yet a government that is increasingly under fire, both for its authoritarian tendencies, but also for fairly hapless response at times. If I may bring Dr. Shahid finally into this conversation, thank you for your patience, Dr. Shahid. Really, if we could zoom out of Bangladesh and focus now on the region, the geopolitical situation that has changed. Tomorrow, a large shipment of Chinese vaccines is due to arrive in Dhaka. Dr. Riaz referred to a deal with India for vaccines that has been put under tremendous challenge because of India's own problems. This falls under the background, of course, of an always complicated relationship between Bangladesh and India, and also a growing presence and influence of China in the region. What else should our listeners be thinking about when they think about the geostrategic landscape that Bangladesh finds itself in at this point in time?
So thanks, Irfan, for having me in this esteemed panel with Dr. Riaz, Dr. Khatun, and Dr. Bulbul. And yes, I mean, I've been hearing, and this what's happening in Bangladesh. And talking to friends and family back home, as well as people who understand the policy circle. It seems like at this point the policymakers are worried because the Indian variant was detected over the weekend. It probably entered before, but it was detected, on Saturday. And a few weeks ago, Bangladesh had provided remdesivir and other drugs to India and closed off its borders to India for the movement of people, but trade is still ongoing. As Dr. Riaz, he touched upon it. The India-China rivalry is flaring up, and we can see that with Bangladesh as well. So the first very interesting development is with the COVID-19 vaccines. So Covishield, which is developed by a joint team of the University of Oxford and AstraZeneca, is produced and marketed by the Indian Serum Institute in India, in Pune. And it was purchased by Bangladesh through a tripartite deal. Two shipments had come in January and February, and then it stopped. And then again, it should be coming in July if things stabilize in India. But we are seeing this massive spike, and also being a scholar who studies India, I mean. With elections, especially in West Bengal, and what happened in North India with the Kumbh Mela, it's probably not coming down anytime soon. In this drastic, attempt to contain an impending disaster, Dhaka had to seek assistance from Beijing and Moscow. So as you said, the Chinese Sinopharm vaccines, they should be coming tomorrow, 500,000 doses. And I think in May, if I'm not wrong, it's also expected that the Russians would also be sending in Sputnik 5, 4 million doses. The second development, which has been all over the news, is with the Quad Security Initiative, which we are all very interested in Washington, of course. The Chinese ambassador recently had said that Bangladesh should not join the initiative, which includes the US, Australia, Japan, and India. And as you probably know, being a scholar in India yourself, the Quad operates very, closely with European nations as well. So France, Germany, Netherlands, they also have their Indo-Pacific strategies, and they appear to be coordinating with the Quad. The Quad, although it was created in 2004 for the intention of providing humanitarian assistance for countries hit by the Indian Ocean tsunami, it is now re-established in 2017 as an informal security medium, with some would say with the intention of countering China's growing assertiveness in the maritime domain. And China, through its ambassador, said, probably told Bangladesh that not to think about it, about joining the Quad. And today, the foreign minister also said that he said that Bangladesh gets to decide its foreign policy, and nobody has actually approached Bangladesh, according to what he said about joining the Quad. And if Bangladesh does not join the Quad, that probably complicates this group's shoring up of support among the countries located in the Bay of Bengal basin for meeting whatever objectives it has. Because obviously, the Bangladesh is a country, with the Gangetic Delta, and it's in the Bay of Bengal, and to its south, and it's if it doesn't join the Quad, it's probably going to be problematic for Washington as well. So I think at this point, Bangladesh finds itself in a dilemma, and it's all over the news, local news, that about the Quad. And so these are two things that we should be considering. The COVID-19 vaccine situation, where it seems as if all eggs were put in one basket, and the whole idea was to get regular shipments from the Serum Institute of India, which obviously cannot happen now. And what's happening with the Quad.
Very good, Dr. Shahid. Thank you for being so efficient with your responses. I mean, and the Quad dynamic is a fascinating one. It's obviously one that you commented on just recently in that piece you wrote with our Project Assistant Kaveri Sarkar on the West Bengal elections, that I urge our listeners to take a look at, because the implications of the US initiative on the Quad have direct ramifications for how Bangladesh finds itself in its relationship with its Western neighbor in India, and obviously its Eastern and Northern neighbor in China. So kind of caught between these giants in a way that we'll try and get back to. So to summarize, right, I mean, what we have heard so far from my esteemed panelists is a health situation that has been incredibly challenging, that, but possibly now with the detection of the Indian variant and the start of a second wave potentially getting worse, making the job for Dr. Bulbul and colleagues even harder. An economy that was showing tremendous signs of success, but now really buffeted pretty dramatically with real-time data, as Dr. Khatun said, indicating that there might be real trouble looming in terms of the ability to mount a recovery. A really challenging political situation per Dr. Riaz, in which an apparent mandate is undermined by deep concerns and criticisms of the quality of the elections, of the authoritarian tendencies of the current government, and finally, an extremely complicated international situation in which Bangladesh needs both, at the immediate moment, vaccines provided both by India and China in order to meet its vaccination goals. But that brings it directly into the broader Sino-Indian competition in the region, and possibly implications therefore for the Quad. Incredibly detailed analysis provided by our panelists already. I'm going to transition now to really beginning to think about what lies ahead, recognizing once again that to talk about post-pandemic Bangladesh is without doubt premature. But the goal of this analysis really is to identify the core lines of thinking that we should all be paying attention to as we analyze and witness what's happening in Bangladesh over the coming months. If you have questions, please do send them in, and I will do my best to weave them into the conversation. Let me go back to Dr. Khatun. Dr. Khatun, at the end of your comments, you were talking about the possibility of a K-shaped recovery, which for listeners less familiar with the lingo refers to essentially some sectors of the economy succeeding, the upward slope of the K, and others, in fact, declining, the downward slope, leading to rising inequality in societies that are already quite structurally unequal. I want maybe to focus your attention really on what you see coming and what you would advise the government to do to support the less privileged in the society, those that informal sector that is such a large part of South Asian economies. What can be done? What should be done? What do you think will be done in the coming months?
Thank you very much. Really difficult question because firstly, that COVID is still unfolding and it's very
Exactly.
uncertain when. So when we are going to overcome this health crisis, we don't know. So and also secondly, it depends also how well we can recover. It depends on the issue that how well we can manage the health crisis. But having said that, the first part of your question that what possible implications it might have and how we can overcome in the coming days as we are seeing that vaccine if the vaccination can happen successfully, if Bangladesh is able to vaccinate at least 80% of this of its population, which is crucial, which is a crucial number according to the scientists and doctors, that it gives you the herd immunity. So now, what I know I was referring to in my previous section of talk is that there has been a lot of the crises and the pressure and the responses um, taken by the government was these are very good and appreciable, and we appreciate the move, particularly the stimulus packages which had been announced by the government, which is about 4.4% of the GDP. For an economy which is low income economy, particularly compared to the other countries like in the US, the stimulus package is about 15% of its GDP, large economy and higher income, higher GDP. But compared to that, 4.4% is okay, but not adequate, definitely. And also that within that stimulus package, 80% is the liquidity support. That is, the loans to be provided by the commercial banks at a discounted or at a lower in interest rate, or at an interest rate, half of the interest rate would be provided by the government, taken care of the government, and the rest half, approximately rest half by the borrowers. And then the rest 20% is the basically the fiscal support. What I was trying to argue in my previous talk is that during this crisis, the need for fiscal support and expansionary fiscal policy is very crucial. From that point of view, this whole dynamics of the stimulus package has not been quite right, because you are putting the burden basically on the affected ones, because those businesses or the sectors, they will have to take loans and they'll have to work towards recovery. And now this is but still then it is something, some kind of help. So what has happened, why this issue brings us to the issue of K-shaped recovery? What has happened that for the larger businesses, the export-oriented businesses, particularly the ready-made garments in sector, they have been quite successful in taking the money and utilizing that. However, the smaller ones, the micro, small, medium enterprises, they are facing the real challenge. Though a substantive amount has been allocated for these small businesses, but the disbursement is very low. Though the other thing, like the ready-made garments, they had exhausted and they had applied for next, installment, and then they had got it. So they have the capacity, but for the smaller ones, two, three issues come here. Firstly, is that the attitude or the whole perspective of the commercial banks toward the micro and small businesses is not very, very, you can't say it's warm. Of course, many say that they provide support to the small SME sector. They have policies, each and every bank has SME policies, but in reality, when they go for loans to the bank, they really have to face a lot of problems. And some of the problems are realistic from the banker's point of view. For example, these small businesses, many of them operate at an informal level, in the sense that many don't have tax identification number, they don't have registration also, trade licenses, and they prefer to be like that because there's some of them are so small, they don't want to go through these hassles. and and also they don't have collaterals, so banks don't want to really help them in such circumstances. But on the other hand, also that these people have been, many of them have started their businesses through loans from informal channel, either from their savings or loans from their families and friends and all. And also, we have in Bangladesh the microfinancial institutions, which have been functioning quite smoothly actually. Though the interest rate is very high, over 20% compared to in 9-10% in the commercial bank, but people, these smaller businesses, they feel comfortable with them. Even those MFIs, they also feel comfortable. They know these people, they have access to each and everyone, so they can supervise, monitor. So though the money has been allocated by the government as part of the stimulus package, I think the operational management had not been quite right. So what we have been arguing that these money should be provided, channeled through the MFIs, where you have some lenience in terms of, giving the loans. This is one, and that is why we're saying, since the disbursement for these smaller businesses had been so low, and many of them had to shut down their businesses, and we had done several surveys also. Many did not, get access to finance. They had to shut down. They had to lay off their workers,
Right.
down and all. So that's why they will recover, they will take a longer time, which also means that, inequality, which has been a problem in Bangladesh, we boast about our high growth and all, but inequality has been a challenge, and this growth had not been equalizer.
Right.
On the one hand, we are progressing, our per capita income is increasing, but on the other hand, the inequality has also been
Right. If
increasing.
I
So
may
it
cut
is
you
a
off,
dilemma. I think the COVID will, and I'll just stop you by saying one line, that the COVID is going to, going to increase the inequality, and many of the achievements, not only economic achievement, but also social achievements, gender empowerment, gender parity in education, all these are going to be reversed because of this COVID-19. And
thank
we
you.
have to work towards that very hard.
Thank you, Dr. Khatun. Dr. Bulbul, I realize, of course, that being in a health situation, you undoubtedly hear the argument from those concerned with the economy that the lockdown and other measures that are put in place by public health professionals like yourself hurt the economy. And yet, of course, that the playbook for fighting COVID, flattening the curve, is one that requires social isolation, relative isolation, etc. I would love to hear your thoughts on sort of how that balance is being made within the ministry. But more generally and more specifically, what should we expect to happen with the vaccination campaign in Bangladesh? And what is the strategy for vaccinating those who are less privileged, those in the slums, those in the more rural areas, as we get, it's a challenge all over the world, and in densely populated, unequal societies in South Asia, even more so. How are you and your colleagues working to deal with vaccine inequality going forward?
Thank you very much. I think this is very much pertinent questions. As you have heard earlier, that Bangladesh actually tried to focus on vaccination in 2020, I mean, on almost April. And also we joined very earlier in the COVAX facility, the initiatives of WHO, Gavi, and CEPI. So we actually try to ensure the availability of the vaccines from the COVAX facilities especially the AstraZeneca as well as Pfizer, as well as we also tried for other vaccines. But due to the environment and the situation, we mostly focus on the Oxford AstraZeneca, that is Covishield from India. However, when we try to, we understand that the situation might become worse in India, and we might fail to get a vaccine from them. Then we also, not that before that, we also try to keep communications with China and Russia. So hopefully tomorrow we are going to get 5 lakh dose, and hopefully soon, a few days later, from Russia. Uh, you know that EPI, expanded the program of immunization, is very much famous in Bangladesh, and this is really, good programs in Bangladesh. So the last days, last months, we conducted the vaccinations program for COVID-19. It was really, I will say, in a sense, successful, because there was no any case of fatality, much problem. But you mentioned there is problem with, other part, the marginalized part, those who lives in slum, as well as in the very rural part or hard to reach area. You know that our next focus is actually to engage them into these initiatives, so that they can actually get the vaccine very easy way. And we will jump over that issues. We have uh, these steps in our mind. So what actually we will do after the Eid vacation, we will actually try to focus in our plan, so that how we can engage the people who lives in slum, as well as lives in hard to reach area, to make vaccinated. And also our government is actually trying, for the betterment of the poor people. Our government also going to provide some sort of VGD, VGF for the people, as well as that government is providing social safety net for the poor people. So also it will include in the social safety net the vaccination programs for the poor people, so that they can easily get the vaccines without any delay within a few months, hopefully.
Very good. Thank you. Let me ask you two very quick follow-up questions, and I would appreciate it if you would keep the answers as short as is fair to you. Okay, I want to make sure we use all our time with the other panelists as well. On genomic testing of COVID strains, how would you assess the government's performance so far? Not just the government, but the ability of the public health infrastructure to do genomic testing to identify new variants quickly. And second, the provision of PPE and health infrastructure beyond vaccination. Obviously, vaccination is the long-term goal, but in the short run, as we see in the horrific scenes coming out of India, hospital systems can be quickly overwhelmed by uptick in cases. What is the government doing to ensure that similar situations don't play out in Dhaka and other big cities in terms of oxygen, in terms of PPE, in terms of beds, etc.? Just really quickly, please.
Thank you very much. This is also, it was a big challenge when we initially started to have normal test, even, PCR. We started with one lab, but fortunately now it becomes, almost, adequate, so that people do not suffer too much. Also, we have started the rapid antigen test, almost all the upazila, we are expanding, but almost half of the upazila are now doing the rapid antigen test. Hopefully, it will be almost a whole of the health complex, I mean government facilities, there will be. But as you mentioned, that the genomic sequencing and all this, the identify the structure of the vaccines. So also we have, but there is still, I mean, a few limitations, so that we can't do it very rapidly. But I think we almost identified the Indian variant very recently. I mean, day before yesterday, almost 8 people we have identified the Indian variant, and we are very much aware about that. You already mentioned that we have sealed out the border. But you know that India, Bangladesh is very much, I mean, close. There are a lot of relatives in India, and also a lot of relatives of Indian people into Bangladesh. So it's really tough, but we are trying our best. For PP and other management issues, we have almost adequate PPA now in our hands, because a lot of public, I mean, private companies come up with a lot of ideas to prepare the PPEs, and they actually provided us. Also, we have received a lot of PPEs from outside of the countries as well, as donation, and also government has procured much more. We are preparing ourselves while we provide vaccine to the people. We'll be keep, I mean, very much uh, concerned about these issues, so that
Okay.
the health care provider do not get infected. Thank you very much.
No, thank you, sir. Dr. Shahid, two quick, well, they're not quick, they're complicated questions, but maybe you can give us quick responses. The first, the reference to borders, of course, evokes powerful images of the Rohingya refugees that Bangladesh has been home to, a very complicated set of relationships that you have been writing about for some time. How should we think about the refugee camps? What is happening in those camps in terms of access to healthcare, vaccinations? What is the status of those refugees in terms of the possibility of being sent back to Myanmar as opposed to being provided asylum? And then a question from one of our listeners, Mr. Richard Wallace, who asks, should Bangladesh choose not to join the Quad Security Initiative, what are the immediate implications for its bilateral relations with India? Would it make them worse, or would those persist in spite of the multilateral decision? So just in a couple of minutes, because I have a final question for Dr. Riaz as well. So, Dr.
Right. So, Irfan, I'll keep it really short. I just wanted to add something to what Dr. Bulbul was saying. Actually, there is really good genome sequencing happening in Dhaka itself with the Child Health Research Foundation establishment, and they are funded by the Gates Foundation. Just wanted to add to that. Yeah, in terms of the Rohingyas, well, that is, in the midst of all the negative things that we're hearing in South Asia, at least, we're hearing something positive with the Rohingya community, in the sense that they can be, there's a scope for them to be resettled into third countries. So, the foreign minister, Dr. Momen, he recently said that the US Biden administration would take a good number of refugees this year and in 2022. So, Bangladesh has been fortunate with not a lot of deaths up till now, touch wood. And with the Rohingyas, only, there has been, 11 fatalities. With the repatriation, I think the angle that Bangladesh was looking at, I think they've probably dropped it. I'm presuming, because of the coup, and obviously, every other ethnic group is suffering at this point, and the Rohingyas, who are a stateless group and who are considered illegal migrants, in Burma, I don't think the junta would be very welcoming to them. So I think one very good example that the Bangladesh government can study from South Asia itself is the case of the Lhotshampa refugees who were stranded in Nepalese refugee camps in the 90s and then resettled into third countries, particularly the US and the UK. So there you go. There's some hope over there. And with the Rohingya situation, I just want to add that it's very hard to maintain social distancing. I mean, the camps that we have in Cox's Bazar, the density is 3 times that of Manhattan. So when vaccination happens when the whole population of Bangladesh is to be will be vaccinated, and if everything goes properly, it'll take at least a year from what I know from my sources. The technical committee team, I have talked to them, somebody from there, the National Technical Committee team. So the UNHCR has been calling for inclusion of refugees and internally displaced and stateless people into national vaccination programs. And so the international community also needs to step up and help Bangladesh, because 1.1 million Rohingyas are now in Bangladesh, and they are probably really they're probably the most vulnerable at this point in time. So that's there. And yes, with the Quad, I'll just say that yes, I mean, with India, things have been fragile, although we can see from Mr. Modi's visit in late March, with the 50th anniversary of Bangladesh's independence, there were riots, I mean, to be frank. And these were staged by Islamist groups, but at the same time, leftist organizations were also protesting. So things have been problematic there as well. And if Bangladesh does not join the Quad, along with India, I think the US will also not be very happy. So it's a matter of balancing India and China, which is getting more and more complicated. And I think among all the countries in the region, Bangladesh has done this really well, tactfully, because there's this whole idea of a debt trap that countries get into when they deal with China, but Bangladesh has not gotten into as yet. So now it's facing the pressure. So now it's actually the policymakers in Dhaka. This is their main challenge now.
Uh, Let me say, Dr. Riaz, I feel like we've not nearly exploited all of what you have to offer us. So let me ask you a final big question. When all of this is done, and hopefully everyone's vaccinated, the implications of your analysis for Bangladesh's democracy and civil society will persist. Azrat Khan, another one of our listeners, asked about the civil society implications. What happens to Bangladesh's democracy coming out of this? Is there reason for optimism, or should we be expecting that to be the one long-term casualty of this pandemic?
Well, let me come back to this, if you allow me. The first thing, the Quad discussion that we, has not gone that much. If I may, I would add a few things to that. So far, the conversation with respect to Indo-Pacific strategies / Quad, what we have heard is this Chinese version, what China is saying, and of course, US is not going to be here. The problematic part is this binary that the Bangladeshi policymakers have so far been pretty much stuck with. That is the choice between India and China. I don't think that is the best option for Bangladesh. Either China, I mean, the vaccine diplomacy that we have seen, they preferred India. Why? Because of the political relationship with the current regime. So they have to get out of this mindset that, yes, China should not be dictating. I completely agree with the Bangladesh foreign minister that China should not be, for that matter, India should not be dictating. Neither should Washington be dictating Bangladesh foreign policy. Bangladesh is a sovereign country. However, given the geopolitical shift we're witnessing, given this contestation that we're witnessing, and if I may, a year ago in Atlantic Council's website, I wrote a piece, and I mentioned that, look, watch Bangladesh. What is going to happen with respect to India-Bangladesh contestation? Watch Bangladesh. You don't have to see anywhere. So a year later, it has come to pass, not in a happy way, or hopefully it would have turned differently. But at this point, this conversation with respect to Bangladesh's alignment, it doesn't have to take a complete, reversal of the course. Bangladesh's over-dependence on India, to put all in one basket, and its political alliance, which is dictating its foreign policy, they should need to reassess that. That is the point. So Quad is not only a matter of aligning with India, it is also a matter of getting out of this binary that they need. Coming back to your question, which is a very important one, which is democracy the casualty of COVID-19 in Bangladesh? Bangladesh democracy was backsliding even before the COVID-19. So is it the casualty of COVID-19? No, it is not a casualty. It has accelerated, accentuated, criminalized the dissent, and allowed government to go after, and not to mention the abject failure of the opposition to mount any kind of formidable, policy alternative that has created a situation. However, I'm optimistic because I'm optimistic in the sense that it is not going to be sliding towards. There's always the possibility. Hybrid regimes tend to slide towards authoritarianism. Cambodia is a case in point, and elsewhere too. But I hope that the Bangladeshi civil society will rise from the ashes because it cannot continue. Look at what is happening in the media scene. There are at least some voices now speaking that this cannot go on in perpetuity. So, and Bangladesh's aspirations for democracy, it has fought 71, and for even if we don't consider 1991, and throughout this whole period, the aspiration of democracy is there. Inclusivity, it has to return. How? When? I wish it is tomorrow. I wish it was yesterday, but the point is, going forward, there has to be an accountable, transparent system. And how do you reach there? Only one way to start the process. Having an election which is inclusive, which is fair, which is accountable, and which is inclusive. That is the way. Hopefully that would be the right. But I'm also afraid the second option is the sliding towards further authoritarianism.
Right. Dr. Riaz, thank you. We are out of time for a conversation that could have lasted another hour quite easily. My deepest thanks to Dr. Bulbul, Dr. Khatun, Dr. Shahid, Dr. Riaz for taking the time today to share their incredible expertise, their insights, for their willingness to be frank and honest, to be provocative, to be thoughtful above all else. My deepest thanks also to my colleagues at the Atlantic Council, in particular, incredible AV team, and to Ms. Kaveri Sarkar, our project assistant, without whose tireless efforts today's program would not have been possible. We invite you to come back to us. There's a lot of commentary on our website, including by Dr. Shahid and Dr. Riaz, about Bangladesh. But most of all, we wish those celebrating a very happy Eid. We hope you and your family stay safe, and we look forward to meeting in person, inshallah. Take care. Thank you.